Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about Paratharmone. Paratharmone is produced by Parathyroid glands. In the parathyroid glands, we have two cells. One we have chief cells and the other we have auxentic cells. Okay, these chief cells will produce Paratharmone, whereas these auxentic cells, auxophil cells. Auxentic cells are present in stomach. These are auxophil cells. These auxophil cells have no function. Okay, normally if you see, these chief cells are converted to auxophil cells on after aging. Okay, then now what are the factors when is paratharmone secretion? If you see, what are the conditions in which it is increased and what are the conditions in which it is decreased? Paratharmone secretion is increased in hypocalcemia. It is increased in, this is main, okay, it is increased in hypomagnesemia, that will mild increase. It is increased in hyperphosphatemia, and whenever catecholamines are released, it is increased. Whereas when is paratharmone secretion decreased? It is decreased in hypercalcemia. It is decreased when there is 125 dihydroxy vitamin D, active form of vitamin D will decrease paratharmone secretion. Then severe hypomagnesemia will decrease. See, mild hypomagnesemia will increase calcium production, whereas severe hypomagnesemia will decrease calcium production. If there is combined, one more important sentence is, if there is combined decrease in magnesium and calcium, combined decrease in magnesium and calcium causes resistance to paratharmone action. It will cause resistance to paratharmone action. Okay, then next, whenever there is high calcium, this high calcium will activate the calcium sensor. Whenever there is high calcium, it activates the calcium sensor. This calcium sensor will decrease the paratharmone release. Where is this calcium sensor present? This calcium sensor is important. Okay, so whenever there is high calcium, this will activate calcium sensor and thus it will decrease the paratharmone release. Okay, then whenever there is low calcium, this will inhibit or make the calcium sensor inactive. This will make the calcium sensor inactive and thus it increases paratharmone release. Because calcium sensor is inactive, it will increase paratharmone release. Okay, then the actions. Okay, it has actions on bone, it has actions on kidney, then it also has actions on intestine. This is indirect action, and it also has actions on parathyroid itself. This is also indirect action. Okay, so how does the action of parathyroid and intestine occurs? So what this paratharmone do is, this Paratharmone will activate vitamin D, 125 dihydroxy vitamin D. Now this vitamin D will activate kidneys and parathyroid again. So it has action of Paratharmone in the kidneys and parathyroid is through vitamin D, not directly. Okay. Whereas what is happening in the bones? In the bones, if you see Paratharmone, so what are the actions of Paratharmone on bone? In the bone, if you see, it will regulate MCSF, rank ligand and osteoprotogerin in osteoblasts. Right. It has two types of actions in the bone based on the concentration or release, based on release of Paratharmone. So if you see, it has two actions on Paratharmone based on release. So the first action is if there is intermittent Paratharmone release. Intermittent Paratharmone release will promote osteoblast formation. It will promote osteoblast bone formation. Intermittent Paratharmone release will promote osteoblast bone formation. Whereas if there is high chronic levels of Paratharmone, this will promote osteoclastic bone formation. Okay, so these are the two important actions of Paratharmone on bone. Then if you see Paratharmone actions on kidney. On kidney, it depends on both DCT and proximal convoluted tubule. That is PCT and distal tubules. In the proximal convoluted tubule, this Paratharmone will stimulate 1-alpha hydroxylase activity. When it stimulates 1-alpha hydroxylase activity, it will inhibit inorganic phosphate resorption on proximal tubule. So it is inhibiting the reabsorption of inorganic phosphate. Okay, I will just draw the diagram also. Then if you see in the distal tubule, what does this do? In the distal tubule, it will stimulate calcium reabsorption in the distal tubule. So if you see, this is the proximal convoluted tubule, this is the distal tubule. Okay, in proximal convoluted tubule, there is an enzyme called as 1-alpha hydroxylase. This 1-alpha hydroxylase is activated by Paratharmone. Okay, and here there is a transporter which is sodium inorganic phosphate co-transporter. Okay, it activates the 1-alpha hydroxylase, and this will also inhibit this transporter. Whereas this transporter is actually promoted by or activated by vitamin D. Thus causing in vitamin D, it causes increased phosphate reabsorption, inorganic phosphate reabsorption. Then if you see in the distal tubule, in the distal tubule, there will be a channel which is called as TRPV6/5. Okay, through this channel, calcium will enter. Now Paratharmone will activate this channel. Now this calcium, once it enters the cell, it will bind to calbindin. It will bind to calbindin. And then this calcium is also absorbed into the blood. This is lumen by sodium calcium exchanger. Okay, so this is how the paratharmone acts. Now, where are paratharmone receptors present? What are the paratharmone receptors and where are they present? So, the types of paratharmone, we will have to see the types of paratharmone receptors. Paratharmone receptors are of mainly two types. We have two different types of paratharmone, actually three different types of paratharmone receptors. One PTH, one R, which is for hormone paratharmone, and for paratharmone related peptide will also bind to this. Okay, this acts via cyclic AMP is the main pathway, and additionally it also acts via IP3 calcium pathway, and thus this is present on bones, which is osteoblast, it is present, and it is present on kidney. Okay, whereas the second one is paratharmone 2 receptor, which is for hormone paratharmone 2. It is for hormone paratharmone 2, and this is mainly by cyclic AMP, and it is present in brain, placenta, it is present in pancreas and in testis. Okay, then we have the third type, which is CPTH, which is mainly present on osteocyte. See, overall there are no paratharmone receptors on intestine. Why? Because in the intestine there is no direct action on intestine. On intestine there is indirect action. So there are no paratharmone receptors on intestine. Okay, next important thing. Right, let us now learn about some important points about CPTH. Okay, CPTH is nothing but it is carboxy terminal PTH fragments. It is carboxy terminal PTH fragments. This is actually generated by both direct secretion. It is generated by both direct secretion from parathyroids. It is generated by both direct secretion from parathyroids, or it is generated by catabolism of paratharmone, which is operated by Kupffer cells. By Kupffer cell degradation of paratharmone also these will generate. Okay, this CPTH will interact with the CPTH receptor. Carboxy terminal paratharmone will interact with carboxy terminal paratharmone receptor, which was already dealt. Okay. Thus it will affect some specific effects on calcium homeostasis and bone metabolism. Okay, this is about the CPTH. Then let us now learn about paratharmone related peptide. So in the paratharmone related peptide, which is PTHRP. Okay, this paratharmone related peptide is produced by skin. It is produced by hair, breast. Okay, and this will regulate the proliferation and differentiation. It will regulate proliferation and differentiation. This paratharmone related peptide also plays a role in relaxation of smooth muscles. How does it relax the smooth muscles? It relaxes the smooth muscles by stretching in blood vessels It also relaxes the smooth muscles by stretching the uterus, okay, and bladder. Then during lactation, this paratharmone releasing peptide will promote the maternal bone resorption. It will promote maternal bone resorption, and also it will promote the transport of calcium into milk. That is during lactation. And if you see during development, this paratharmone releasing peptide will regulate calcium transport across the placenta. It will regulate calcium transport across the placenta, and thus it will regulate chondrocyte proliferation. It will regulate calcium transport across placenta and regulates chondrocyte proliferation and differentiation in growth plates of long bones. Okay, it will regulate chondrocyte proliferation and differentiation in growth plates of long bones. That is during development. But if you see in adults, the paratharmone releasing peptide has no action on calcium homeostasis. But whenever certain tumors, those tumors will secrete high levels of paratharmone releasing peptide and produces something called as hypercalcemia of malignancy, and thus it will have symptoms which are resembling parathyroidism. Okay, so thank you for watching.
Thank you, and thank you for watching.